I'm Dr. John Croasdell, and I've been here at Scott Memorial Health for 24 years. It's been a while. It's been a minute. I've enjoyed serving the community, first as a family physician, and now as an emergency physician and the facility medical director for the emergency department. So they wanted me to talk about stroke today. I'm going to start out by identifying some signs and symptoms of a stroke. We have a little mnemonic FAST, and that stands for facial paralysis. So you ask the person simply to smile. And if their smile's kind of cockeyed, then that's a dead giveaway for a possibility of a facial nerve paralysis, which goes along with stroke. The next is A, arms, and if they raise their arms and one kind of drifts off or gets weak, then that's a possibility of a stroke as well. The next is S, and that stands for speech. So if their speech is garbled, you ask them to, say a simple sentence like Jack and Jill went up the hill to fetch a pail of water, and if that seems unclear or garbled at all, then there may be a problem. The T in FAST stands for time, because time is of the essence. Time is very important. When you have a stroke, most of the strokes are due to what we call ischemic stroke, or a blockage of the blood vessel that supplies that portion of the brain. 87% of strokes that happen that are acute like that, where you got facial paralysis, where your arms are drifting and there's weakness, skeletal muscle weakness, or your speech is disturbed, is due to a clot that is in that vessel that's supplying that part of the brain to those areas. And we only have a certain amount of time before those nerves, those neurons, that brain tissue is irreversibly damaged. So we have to get that clot dissolved or opened back up quickly. And we like to do that as fast as possible. So we like to do that usually within 3 hours. If we can get the person here and we know the last time well is within 3 hours, then that person has a better chance of recovering from that stroke than if they wait. Waiting's a big, big no-no. You don't want to wait once you have those symptoms in a stroke. We talk about being stroke smart, talking about reducing, recognizing, and responding immediately to any stroke symptoms. At the very first sign of a stroke, you want to dial 911 so that ambulance and paramedic team can get you to a hospital that can take care of you immediately so that you don't end up with permanent paralysis. That's the whole point, so that you can walk and talk normally, enjoy the rest of your life, work, enjoy your family, enjoy your grandkids, which I just had one. So stroke is one of the leading causes of death in the United States. It's not the leading cause. I think heart disease is still up there. 795,000 Americans suffer a stroke each year. There's 134,000 deaths each year. We've lost over 200,000 people to the COVID-19 crisis in less than a year. So about that many, give or take a few, die that each year from stroke. And right now, there's estimated 6.5 million stroke survivors. So some of those people are severely handicapped and live in nursing homes, total care. Some are mildly to moderately handicapped, and some are walking around normal because of rapid stroke care that we can provide. 80%, it's estimated, of strokes are preventable. There's some things that we can do, like quit smoking, control our cholesterol, get our blood pressure under control. There's a few things that you can't do anything about, and that's family history. Sometimes our genetics predispose us to those vessels being blocked in the brain. You can't change your genetics, and you can't change your race. Unfortunately, still, there's some race differences. Black individuals tend to do worse from stroke than Hispanic individuals and Caucasian individuals. So there's some risk stratification there. Women in stroke, it kills twice as many American women as breast cancer does. Think of that one. So more women than men die from stroke, and the risk is higher for women because they have a higher life expectancy. I think my life insurance told me my life expectancy is 92 and my wife's is 95, so she's going to have 3 years to spend the rest of my money. But at any rate, women tend to suffer greater disability after a stroke than men, and women ages 45 to 54 are experiencing a stroke surge right now. And because you ladies, You need to modify your risk factors a little better. You took on smoking like some of the guys did, and now your risks are just as much or even more than the guys are. The definition of a stroke, just so you know, sudden onset of brain damage and dysfunction. And it's caused by a lack of blood flow, caused by a clot. Typically 13% are due to a different kind of stroke, and that's a bleed in the brain. They're treated differently, obviously. With a stroke caused by a clot, we want to dissolve or go and retrieve that clot and get it out of the way of blocking that blood flow. With a hemorrhagic stroke, there's something that's bleeding. So we have to go in and stop that bleeding, and that's a different method of treatment. The stroke symptoms that I really want you to be aware of, besides the fast, sudden and severe headache. You get the thunderclap headache that we talk about, and that's usually caused by a brain bleed. You get sudden trouble in seeing in both eyes or just one eye. Sometimes it'll go completely black, or you'll lose half of the visual field. Sudden dizziness or trouble walking or staying upright. Some people that I've had what we call posterior circulation strokes have difficulty standing upright. They come in and say, I feel like I'm drunk because I can't walk right. That could be a sign of a stroke. Sudden confusion. You don't know where you are, what you're doing. You lose track of what you were doing. And then sudden numbness or weakness in your face, your arm, or your leg. And that's usually on one side of the body. It usually doesn't cross over. There's something called euphemistically a mini stroke. That's really not a correct term. What we call a TIA, or a transient ischemic attack, is usually a warning sign of a stroke. There's estimated up to 40% of the people that will have a TIA will have a stroke. And what I mean when I say TIA, transient ischemic attack, you lose the ability for that side of your face and this arm and your left leg, let's say we're talking about the left side of the body, for 30 minutes. And then it comes back and you think, oh, well, that was weird. That could be an early sign of a problem. So you need to get to care right away for that as well. Don't delay. All of these things, don't delay. By the way, we here at Scott Memorial Health are in the process of going through a stroke accreditation through University of Kentucky and Norton Hospital, and we're doing pretty good. We've got a lot of different protocols to put in place and times of study, such as getting a CT done quickly and getting it read and getting the report to us, and then getting all of our physicians and nursing staff trained in rapid stroke care. So we're in that process right now. And I feel pretty good about it. I would feel pretty good about coming to this hospital with one of my family members, knowing that we could take care of that situation. We talk about the reality and myths. You know, some people are out there and they say, well, I'm having a stroke, nothing can be done about it. I'm just going to go ahead and you know, they can't do anything for me. My arm's not working. They're not going to be able to make it work again. That's a myth, okay? We can help you out with that. Strokes are able to be reversed sometimes with that effective care. So make sure you come in fast. The National Stroke Association talks about 3 hours. We can sometimes even reverse those out to 4.5 hours. So please get in quickly. That's the most important thing. There's a myth out there that stroke is not preventable. Wrong. If you eat right, if you exercise, if you quit smoking or don't start smoking, if you control your cholesterol, your blood sugar, all those risk factors, high blood pressure, diabetes, high cholesterol, you can actually prevent 80% of the strokes based on that. So those are things that you can do for yourself. Can't change your genetics. So all those things that you can do, please participate in trying to reduce your cardiovascular and stroke risk. A stroke only strikes the elderly. I don't know how many of you know a linebacker that played for the Patriots, the New England Patriots, a team I love to hate. Teddy Bruschi, I think he was only like 36 years old, and he had an ischemic stroke, and they got to him in time. He's not paralyzed. He's a sports announcer today. So it doesn't only strike the elderly, it can strike young people too. Definitely, I want to dispel this myth. I hope this has been clear with this entire presentation. Strokes can be treated. Don't think that because you got paralysis, it's going to be permanent and it can't be treated. Multiple modalities. We have partners down at Norton Hospital that do amazing thing with catheters, and they can go in and take care of that for us. So please make sure that you take this to heart, come in early, recognize that stroke, those stroke symptoms, and get to care as fast as you can. I hope this has been educational for you.